CCS-P exam prep. This is week 1, and throughout these sessions, we will learn the following. Of course, there are 4 sessions. During week 1, we will cover domains 1 and 2. When I say domains, I'm talking about AHIMA domains. This is how they identify the sections of the exam. Week 2, we're going to review domains 3 and 4. Week 3, domain 5, and week 3, domain 5 and week 4, medical coding scenarios. Now, I just want you to know that this information comes directly from AHIMA, and you can go to the AHIMA website, ahima.org, for all of the information that you need in reference to your exam. So I do encourage you to do the following. Go to www.ahima.org. You'll come to the main page, and to the right, it will tell you or give you the opportunity to become a member. I would recommend that because you get considerable amount discounted for your exam and books. So go ahead and become a member. For as long as you are a student, you will pay $49.99. After you've done that, click on Certification and Careers. Then click on CCS-P. And when you click on CCS-P, it will bring you to this page, and to the left, this left-hand panel, everything you need to know about that CCS-P exam is here. The overview of the exam, eligibility, how to get prepared, how to apply for the exam, about the exam, and mandatory code books. Now, just so you know, that is exactly where I got the domains and the information about what is on the exam. And today we're going to discuss domains 1 and 2. And now that we're talking about all these domains, there are 5 domains, and we will review all of them during these sessions. Now, the required text for this, look at that. Let's go ahead and correct it. Oh, I can't correct it. Okay, because that's an image. The CCS-P exam and preparation, here are the required text. All right, so these 4 are, no, it's not PCS. What am I doing here? Let's go ahead and do it right. All right, so these 3 are required. We're going to try and let's go back. Interesting. Okay. I don't want to leave without um, that off the screen. It won't leave. Okay. So the ICD-10-CM expert for hospitals, the HCPCS level 2, and the CPT 2024 are required for the exam. I'm saying required if you are testing between May 1st through April 30th, 2025. Not before May 1st. So if you're testing before May 1st, please let me know. Now, when it comes to this class, additionally, these 2 texts are required. The AHIMA Principles of Healthcare Reimbursement and Revenue Cycle Management, as well as the Certified Coding Specialist Physician-Based Exam Prep Manual. And they're both through AHIMA, and you can buy it on the AHIMA website for a reduced price if you are a member. You know, this is really interesting that I can't get my books off, but it's okay. All right, I have a disclaimer, and this disclaimer is very important. All right, so someone said they have a membership from that is not an AHIMA membership, it does make a difference. If you do not intend to take the CCSP, this is not, you should not be in this class because it's going to be overload of information. And a lot of this information is not pertinent to the other coding exams. All right, so if you're not taking the CCSP, then you should not test. All right, someone said that they're trying to test before May 1st, so you don't need to purchase new books. You will need to have 2023 manuals up until April 30th, 2024. Okay. So hopefully that is addressed. And again, if you are not taking the CCSP, this is not for you. Do not, I would advise you not to do this because it'll be too much. But if you're going to take the CPC, go ahead, take the CPC, then come back and view this. That's what I recommend. All right, I got a disclaimer. This is an advanced professional coding CCSP exam prep group, and you must know the following. You must know ICD-10-CM guidelines, and you must know CPT guidelines. You don't have to know them per se, but know that they exist and be familiar with several of the guidelines that we've reviewed in class. And if you've skimmed your instruction, some people are independent learners and they're skimmers. Hey, my hand is up. I am a skimmer. I am indeed. But when I became a coder, I realized skimming is not going to work. It is not. You're going to have to read very carefully and you're going to have to know the material. But I will help you. All right. So if you've skimmed this material and kind of got by, you may have to go back and refocus on the guidelines. Using your MCG is highly recommended. All right. All right. So now we're going to discuss domain one. And what is domain one? Well, the tasks are number one, review medical record documentation and accurately assign ICD-10-CM codes. Number two, apply ICD-10-CM conventions and guidelines to accurately code to the highest level of specificity. All right. So that's what it is. So here are my tips for domain one. Recognize the diagnoses that have guidelines attached to them. Also, know the categories and some diagnosis codes on site. You just have to know them because it will give you a considerable advantage when you're taking this exam. All right. Um, let's see here. Seems like something is missing. Oh, you know what? I know what the problem is. Hang tight. All right. The problem is that I was looking at the wrong. That's why. Okay. I may have been looking at the interns. Maybe not. I'm going to need a moment. So if you have questions, go ahead and type them in the chat. Hmm. Okay, I got it. All right, so no questions so far? All right. Okay, so when I say that you need to know some stuff to give yourself an advantage on this exam, this is what you should know. Now, this isn't the time for us to kind of review it, but it is the time for me to show you. And if you're going to watch the playback, then you will see it. You'll see it and you can pause it and whatever you need. All right. So you should know sepsis on site. You should see this diagnosis code and recognize that it is sepsis. You should recognize HIV, dehydration, hypertension, I-10, I-11 with one means one heart. I-12 means hypertension with kidneys. I-13 is all three, hypertension, heart, and two kidneys. It's all three is hypertensive heart disease. You should know that on site. Study it. I-21.9 is acute myocardial infarction. Atherosclerotic heart disease, or CAD, I-25.10. Old myocardial infarction, that's older than 4 weeks, 4 weeks or older, I-25.2. Congestive heart failure, I-50.9. COPD, J44.9. Acute renal failure, N17.9. And then over here, you got chronic kidney failure. Know that it's from the N18 category. No pain on site, G89. Know the personal history, Z85 code. Family history code, Z80. Long-term use of medication, Z79. Your secondary cancer codes, your when I'm saying secondary, this is cancer that has metastasized. They're coded from C77, C78, and C79. Normal delivery, that's nothing other than an episiotomy, 080. Type 2 diabetes, E11.9. Type 1 diabetes, E10.9. And you need to know these adverse effects versus poisonings. And we're going to take a look at those a little later. But that 6-character space is a 5 if it's an adverse effect. What are you talking about, Mrs. J? It's going to make sense a little later. And then poisoning means, well, adverse effect means that it was correctly prescribed and administered. Poisoning means incorrect. It wasn't even prescribed. That's a poisoning. So know the difference between those two. This list isn't that big, right? So, and you're going to see these, or you should have seen these over and over and over, and you probably already know some of these, right? Exactly. I'm not going to go through these 22 chapters of ICD-10-CM categories because you know them. You do. You need to know when you see anything from A through B99 that that's an infectious disease, etc. All right. So make sure you review them as well. And later on, it may prove helpful. Also, you need to know some of the diagnoses, specific diagnoses that have guidelines attached to them. You know, AIDS has guidelines. They have guidelines, right? You know, sepsis have guidelines. Specific coding guidelines. You know, neoplasms have specific coding guidelines. You know, endocrine system, diabetes has specific coding guidelines. You know, pain has specific coding guidelines. You know, hypertension has specific coding guidelines, and basically just to be able to distinguish I-10, 11, 12, and 13. You know, acute myocardial infarction have guidelines. You know, respiratory diseases such as COPD with exacerbation, and acute respiratory failure all have guidelines. Pregnancy, you should know how to code a pregnancy. Perinatal disorders and diseases, Chapter 16, you should know that there are guidelines attached to coding for perinatal conditions. Chapter 19, guidelines for fractures. Definitely, there are guidelines. Chapter 19 also have guidelines for burns and how to code them. Chapter 19 have guidelines for adverse effects or poisonings. I was just talking about some of the guidelines. Now it's time to review Domain 1 from the perspective of the AHIMA exam prep book. But before we go any further, I want to take a peek in the chat and I want to see if there are any questions. And if you felt Mrs. J was going fast, well, let me tell you, that exam goes fast and we will be moving at a faster pace. So get your paper and pencil if you need it, and let's go ahead and code. You all ready? All right, so domain 1, nothing but ICD-10-CM. And just to let you know how to solve a scenario for the CCS-P exam for domain 1, number 1, you need to inventory all diagnoses, signs, and symptoms. Number 2, you have to determine the first listed code, or you should always be thinking about what should be sequenced first, right? And 3, apply all pertinent guidelines as quickly as you can. And we are using your exam prep book, 13th edition, and these are there are 4 exams there, and these questions come from exam 1. Exam 1, we're not going to get through all of them tonight, but what we don't complete will be your assignment. All right, so here we go. Domain 1, the physician visits his patient in the hospital and indicates that the patient has diabetes. Insulin is prescribed for and administered to the patient. What is the best decision that the coding professional can make in this situation? A, assign a code for type 1 diabetes mellitus because insulin was administered. B, assign a code for drug-induced diabetes mellitus. C, assign a code for type 2 diabetes mellitus with complications. And D, assign a code for type 2 diabetes mellitus along with a code for insulin use. Okay, Alex, the alligator, I think that's his name. No, Ace, the AMCI alligator. I'm sorry. Your time starts now. You have a minute and a half, and I'm going to keep my eye on the chat. And if you answer sooner, all right, outstanding. Okay, This is what I did. Great job. I saw some fantastic answers in the chat. All right, so what I'm going to do, I'm going to get my ICD-10-CM manual. Now, if it's untapped, I'm going to go use my MCG manual. All right. Now, first, I'm going to inventory. In the documentation, we have diabetes and we also have insulin prescribed and administered to the patient, right? So I got to go get the guideline. I know that diabetes is a specific diagnosis that has guidelines. And so let me just scan that section to see if there's a pertinent guideline. And there is guideline IC4A3, diabetes mellitus, and the use of insulin and oral hypoglycemics and injectable non-insulin drugs. So in other words, in this third column, it says when documentation does not indicate diabetes type, and insulin or oral hypoglycemics are documented, coded as type 2. And you're going to sequence first E11, that's your type 2 diabetes, second Z79.4 for insulin. So, which code, which answer follows that guidance? Well, if we're going to code this as type 2, we're going to eliminate type 1, right? Assign a code for type 1, gotta go. Also, did I read these? Yeah, I did. I think I did. Also, it says assign a code for drug-induced diabetes. No, that is not type 2, but C and D are coding for type 2. We're going to get rid of C because it says assign a code for type 2 diabetes mellitus with complications. No, no type 2 with complications, because we don't have any complications documented. And D is correct. Assign a code for type 2 diabetes mellitus along with a code for insulin use because the guideline tells you. And if you said D, outstanding. Okay, coders, how are you? You all look like you're doing good. Everybody rocked that answer. Okay, we got another. All right. The coding professional would assign a code for which of the following conditions? A, acute lumbar pain. B, bilateral nephrolithiasis. C, possible kidney stones, or D, abnormal X-ray findings. The patient is seen in the ED with acute lumbar pain. The ED physician documents possible kidney stones and orders an X-ray. The radiologist documents bilateral nephrolithiasis. All right, your time begins now. Type your answers in the chat. All right. How you doing? Good job. Good job. We got some answers in the chat. I love it. All right. So, what I'm going to do first, I'm going to inventory all diagnoses, signs, and symptoms. And I also inventoried or wrote down what the doctor did in this case. So, it says that the doctor documented the patient came in with acute lumbar pain. The physician documented possible kidney stones and ordered an x ray, and then the radiologist says, hey, this person has bilateral nephrolithiasis. All right, so what I'm going to do is it says, which code would you assign for the following conditions? Well, I'm going to eliminate acute lumbar pain because I'm looking at my inventory list and I remember the guideline. It says, hey, you do not code signs and symptoms integral or related to a diagnosis on this list. So acute lumbar pain is related to a diagnosis. What is the diagnosis? Bilateral nephrolithiasis, right? So it is related. You can have back pain, absolutely. All right. Also, possible kidney stones is related to that same diagnosis. And then I'm going to get rid of orders x-rays because we're only coding for conditions or diagnosis. And this orders x-ray is not a condition. So the what's left is bilateral nephrolithiasis. So I do want to draw your attention to the guideline and um, codes that describes symptoms and signs. And this comes from these are section um, 4 guidelines. Section 4 outpatient coding and codes that describe signs and symptoms what to do. Basically, you only code them in the absence of a confirmed diagnosis, right? So we don't have we have a confirmed diagnosis and we coded it. So if you said B, outstanding. And if you didn't say B, hopefully that clarification helped or that rationale or explanation helped? And if it did, let me know. All right. All right. We got another scenario. How would this admission be coded? A, Z38.00, P55.0, B, Z38.00, P55.1, C, Z38.00, P55.8, and Z38.00, P55.9. A female infant was born in the hospital at term and at a normal birth weight. It was a vaginal delivery with a vertex presentation. In the hours after birth, jaundice was noted and eventually a diagnosis of erythroblastosis fetalis due to an ABO incompatibility was made. How would you report this admission? Okay, coders, your time begins now. You have a minute and a half. Okay, coders. So I see a bunch of different answers, and this is what I'm going to tell you. If you don't know keyword concept, use your key words. It would, I would say, if there's no guideline, it's going to drive you to the answer if you don't know in the absence of a guideline. That's all I'm saying. And also, too, if you just don't know, use keywords. What have we got to lose? All right, here we go. Here's my inventory. Infant born in the hospital, normal weight, vaginal delivery, jaundice, erythroblastosis fetalis, fetalis, due to ABO incompatibility. If you want to change your answer, go ahead. Okay. All right. So I'm going to eliminate A. Z3 8.00 is correct, but that P5 5.0, I'm getting rid of it. And the reason is keywords. They're talking about RH, ISO immunization of newborn. I'm acting as if I don't know what this is, right? So I don't see any mention of RH, ISO immunization of the newborn. So I'm getting rid of it. I'm also going to get rid of D, P55.9, because this is hemolytic disease of newborn unspecified, even though this is a hemolytic disease. RHs and ABO, these are hemolytic diseases, right? But let's say I don't know, right? But the reason this is wrong is because it says this is unspecified. This doctor was very specific about this disorder. Erythroblastosis fetalis due to ABO incompatibility. So I'm getting rid of it because there's nothing unspecified about this diagnosis. Now I'm left with B and C, P55.1 and P55.8. Okay, coders, are you with me? Okay, one person, but that's okay. All right. All right. So we've gotten rid of A and B, and what's left is P55.1 and P55.8. So if we go to hemolytic disease of newborn, P55.1 is there, and so too is P55.8. And P55.1 is ABO, ISO immunization of newborn. And P55.8 is other hemolytic disease of newborn. I'm going to go with the ABO, right? Because that is a key word. It's even in green, right? I'm going with it. ABO incompatibility, and I'm going with it because it's the key word. Not that I know anything, but I'm getting rid of this other hemolytic disease, and I'm going with my keyword. Now, I will tell you that ABO incompatibility is a form of isoimmunization, and that occurs. It occurs when the immune system is sensitized to foreign antigens, and that leads to an immune response against those antigens. Now, in the context of ABO incompatibility, the mother's immune system may become sensitized to the baby's red blood cells, and then the baby, and it leads to the baby um, obtaining or acquiring these antibodies, right? So, that is what it is. I don't really, I'm not a expert. I just read up on it, okay? So, it is a hemolytic disease, the RH ISO immunization, ABO immunization, but coders, I'm going to tell you this. This is not your moment to know what these are. You know what you know. And it's our job to code to the documentation. And when we're taking this exam, the documentation and the keywords at the code level, the one that matches best is your answer. So we don't have to think about it. We're going to trust our gut and we're going to go with the keywords if we don't know, because we know something, we know that does work. So B is your answer.
Thanks for tuning in, and until next time, happy coding!